Hi, welcome to Pearls of Motherhood. I'm your host, Tessie.
And I'm your host, Diana. Today's episode is one we've been really looking forward to for a long time because we're finally sitting down to share the stories that change our lives forever, our birth stories.
That's right. Between the two of us, we've had 5 births, just about to be 6. And what makes our experiences especially unique is where and how they happened, because they're completely opposite, pretty much. I've had 4 home births. Diana had a hospital birth. And so we're going to dive into both sides of those experiences and like what surprised us, what empowered us, what we learned. And basically, you're going to get like a great encaption of like what both of them are like if you've never experienced one or the other.
That's right. So whether you're preparing for your own birth, reflecting on your past one, or just curious about the differences between home and hospital deliveries, which I have to say, I am very curious about home births. We hope this episode feels like sitting in a cozy circle with your mom friends and we're sharing some amazing stories. But first off, let's start with mom facts. So mom facts. In the US, the cost of a vaginal birth in a hospital can range anywhere between $10,000 to $30,000. And that's without complications or a C-section. And even with insurance, families can pay thousands of out-of-pocket costs from that. While a planned home birth with a licensed midwife usually costs between $2,000 to $6,000, which includes prenatal care, labor and delivery, and postpartum visits. However, this option is often not covered by insurance, so the full cost can fall on the family. While cost is just one part of the decision-making puzzle, it's a really big one. Some families choose home birth to avoid unnecessary interventions, to feel more in control, or to give birth in a familiar and peaceful space, or just saying, hey, a home birth is more aligned with what I want for my family. While others, like me, they find comfort in the resources and immediate medical support a hospital provides. But either way, you come home with someone beautiful.
No kidding.
So Tessie, is that true for a home birth? Is that the cost of it around there?
Yeah, I mean, my cheapest home birth, I had the same midwife every time. Costs go up over time, but my cheapest one was $3,500, and then now it's $52 or $5,800. And I've actually have heard that a lot of midwives are going up into the thousands.
Wow.
6,000s, yeah. But you know what's interesting? If you have like an alternative insurance, I don't know if they're called insurances, but we do like the Christian health sharing type of insurance. We don't have like Blue Cross or traditional insurance. And they actually do cover home birth. They do cover it.
Really?
They cover a lot of alternative stuff because it's a lot cheaper. And they would rather cover it cheaper rather than like wait for something catastrophic and then have to pay like a massive hospital bill. So that's kind of how they manage their funds. But yeah, that's probably, I mean, I don't know if Blue Cross or those other ones would cover it. But we've had ours covered.
So it's for me, I have an insurance that my husband works for. It's the same hospital system that he works for. And I asked about home births and they do not cover it. I had a Blue Cross Blue Shield plan and just out of curiosity, I just asked them and they did not cover home births either.
Not surprising. Not surprising at all.
Yeah, right? But actually, so get this, even with my insurance that my husband works for, and I gave birth in the hospital that they want me to, everything was preferred, I was still hit with another $3,000 bill 2 years after I gave birth. Yes.
No.
And I'm not alone. I have a friend who, same thing. She works for the hospital system. 2 years later, she was hit with an additional $3,000 for her daughter's birth also.
What? Yeah. 2 years? Like there should be a statute of limitations on billing for that's ridiculous.
Yeah, there is. And they just made it. I actually looked that up.
What did they charge you for? Like what on earth they're like, we forgot to add this to your bill? Like what?
So what they said was even though I had met all of my costs, it should have been covered at 100%. It wasn't because they said that the doctor was out of network or something like that. And that was before there was some law passed about additional surprise billing. That was before the surprise billing laws came into effect. So I think they just squeezed it in because I noticed that I got this bill and then that no surprise billing law was passed. I was like, I see what they did.
Wow. This is like a large reason why I tend to avoid the medical system altogether because it is like when I used to partake in it, I guess you could say, we had insurance. We had good insurance. They would bill us, or they would bill my insurance. My insurance would deny it. Then we would get a bill like months later, and we thought it was covered the entire time. To me, it just seems like such a game.
It is.
It's horrible.
It is. But that can be a whole other episode.
I know.
Motherhood and insurance companies. We can totally make one out of that one. I have opinions, and I think you do too.
For sure.
Yeah. So that's the average cost of a home birth versus a hospital birth.
Okay. In book corners, we're going to talk about, this is a book we got through the Imagination Library. I feel like we got anymore. We just get all our books through that because I'm so lazy or whatever. But it's called Danby's Favorite Day, and it's super cute because it came from my daughter, and it's about a little girl, and it's about Korean culture, but she's a Korean American girl. So she's excitedly planning her Children's Day. It's an important holiday in Korea, I guess. And so I think what's cool about the book is you learn about other cultures. Mm-hmm. And so another part about the book is through the book, she has this whole day planned, and it's going to be the best day ever, right? But then she's heartbroken because it starts raining, and it just kind of ruins the entire experience. But the great part about the book is her and her friends, they take creativity, they do teamwork, and then it ends up, even with the flexibility of that, whatever they had to do, it wasn't exactly how they planned, but it ended up being her favorite day regardless. So I love that aspect about it. Yeah.
I love that. And I love that it's multicultural, and it shows, a different type of celebration from what we do every single day, on a regular basis in America. So that's great. And by the way, you're not being lazy by getting your books from Imagination Library. Dolly Parton, her mission is being completed. She wants to bring books. Yeah. She wants to bring books into our homes, and that's exactly what she's doing. So it's a great partnership you have with her.
Yeah.
What a great book. I'm going to have to pick that one up. It's really interesting because our kids are about the same age, but we get completely different books, you and I. I noticed that.
Interesting.
That is. Yeah. All right. Well, thank you for that. So, when you imagine giving birth, what do you picture? Do you picture a hospital room with bright lights and monitors, or a cozy bedroom with a birthing tub? Or maybe you had no idea what to expect until you were in it. Today, we're going to talk about the where of birth, hospital versus home. The choice can be influenced by a lot of things, including cost, culture, medical needs, comfort, fear, or even just what your OB or your midwife recommended. For Tessie and I, the path of bringing our babies into the world look really different. So we're going to open up about our birth stories, the decisions we made, what surprised us, what we do differently, and what we want other moms to know, whether you're still deciding or just want to feel a little less alone in your journey. So Tess, can you give us a quick snapshot of what your birth plan was? I know you're going to have several birth plans, but just in general.
Yeah, they definitely evolved and got better over time.
Really?
Well, I mean, the first one, I didn't know what to expect. I'd never done it. So what I was learning, I was watching YouTube of clearly these very strong or experienced mothers giving birth. And I was like, oh, it doesn't look so bad. I'm not even going to have to push, I didn't even think it was going to be painful. It was really bad. It was a bad depiction on YouTube of what was going on. And so for that birth plan, I guess I even told my midwife, it was funny. I was like, I'm just going to let it come out. I'm not going to push. And she was like, probably not for your first one. And then she made me go do one of those birthing classes. Because clearly I didn't know what I was getting myself into. So, and then I had all of these expectations, I guess, of that it was going to be way easier than it was. I will be honest. And that's the reason I chose home birth too, because I just didn't I did not understand the magnitude. And so then like the next time, then I also like evolved. It evolved because afterwards, you know, I feel like I told family too soon and I didn't get enough time with my baby right away. And so then like as the birth, like my birth plans evolved, I just have just like improved them, I guess. Now with my most recent ones, you know, I'm just like, don't tell anybody for like 5 hours. Like, at least let me have like half a day or a day with my baby. You know what I mean? Things like change and evolve. And then also, since I'm more experienced with it, I know what to expect. And I'm just like, I don't actually do like these big plans. I'm just like, okay, well, here it comes. I'm just going to lay on the bed and like scream at my husband the whole time to get a vasectomy. And then it's going to come out. I'm not doing like these like froofy. I did like my first one, I did a whole, actually what?
So for this one upcoming number 5, are you just going to go with it, or do you have a playlist?
No, I haven't even thought about it. I was just going to go with it. I don't even know what I'm going to do. But, you know, in the moment, you're just so like, you're not really, it's kind of like an out of body experience when you're in that much pain and stuff. And you're just doing what you need to do in the moment and you don't even think about it. So like time passes really fast. I don't know what anybody else around me is doing. I have no clue. I'm just like in my own zone. You know what I mean? Even like all that playlist and stuff, I only remember one song from my first birth because I was like clearly not hearing it.
For me, so one of the big questions that they always ask you for a hospital birth is to ask you to prepare a birth plan. I did the birthing class, and it was virtual. I didn't even do it in person because it was COVID. And they said, what is your birth plan? And you should write it out and bring it with you to the hospital that day. And when I went in, the first thing the nurses asked me is, what is your birth plan? And I always had a go with the flow. I didn't make a playlist. I didn't bring my favorite whatever. I brought my phone, my husband, the bag, and the baby. That's it, because the baby's attached to me. But couldn't forget her. But my goal was to just have a healthy baby, whatever it took. And even if that meant a C-section in the end, so be it. And I saw the look on the nurse's face and they were like, oh, thank goodness.
You're not going to be difficult.
I think for a first-time mom, I think they were expecting me to be very planned because, as you know, I am a planning person. I think that comes across even when you meet me for the first 2 minutes. So they probably thought I had this whole thing set up, and I just said, nope, we're just going to go with it. And so the goal was to have a healthy baby. That's it.
Yeah, it's so funny. My birth plan was like to never go to the hospital. Like whatever it takes, I will not.
So maybe we should go back and discuss why you chose a home birth to begin with for all the babies. Why did you choose a home birth?
Okay, so in our previous episode, I went in a little bit into it, like my experience when I first got pregnant and my experience with the medical system. And then after that, I had already had a little influences from a couple of friends one friend who had done both. So she did her first one in the hospital and she just did not enjoy it. And so then she did her second one at home and she was always raving about how like wonderful it was and how she would wish she did both of them at home and all of this stuff. And then I had another friend who did basically a home birth, but it was at a birthing center. So it wasn't like a hospital. And so I kind of was like, I'd been around it. I had friends who'd done it and like I kind of got the perspective from both sides. And then once I had my experience with what I had, I was like very just looking for something completely different. And so, yeah, then I just like, as I went more and more into the process with my first, I just loved the experience. I just loved it. Like every single appointment with my midwife is an hour long, you know, don't feel like just a number or like rushed. They're just so like loving and it's just such a great relationship that you get to build. You're with them from the start to the finish, you know, it's very different from a hospital birth where it could be a completely different doctor depending on like who's on call that day or if they're out of town or whatever. So like to me, just the bond that you build with the practitioner that you choose it goes a long way because they know you, they learn you. And then also I'm a control freak and I just wanted to be in control of my environment. So that's kind of why I chose home birth. And I think it worked out really well. Obviously it went really well the first time. I mean, there were definitely complications because it's the first time. But after that, I would never do it any other way. It was just so glorious.
Awesome. See, I'm a control freak like you, but for me, I wanted the control of if there was an emergency, I wanted to be by the OR.
Yeah, I think a lot of people feel that way. I think a lot of people could relate.
In our last episode, I mentioned how when I checked in for induction, I asked them for the room closest to the OR. They're like, the OR is central. Don't worry. You are close enough. I'm like, no, but I want to be right next to it because that's me. And I'm glad I did because I learned from my mother. My mother had 4 C-sections and I just thought, you know what? If it comes to C-section, so be it. But I wanted to be in a hospital. If anything goes wrong, because my luck, something can go wrong. It's like Murphy's Law with me. Basically, if you don't think it's going to happen, it's going to happen. So I wanted to be at the hospital next to the OR. I'm surprised I didn't ask to give birth in the OR, a normal birth in the OR just because I'm psychotic. To me, I felt in control by being in the hospital. I think that's really important for when you're making that decision. Where do you feel in control, right?
So I have a few friends whose husbands are just absolutely terrified of them doing home birth and can't get behind it. And it's because they're afraid they want to be close by if there is some complication. I totally understand where the husbands are coming from. And apparently my husband felt the same way, but he just didn't tell me until after.
Well, he is a trained medical professional, and knowing him, he probably had everyone in the hospital on standby. I bet you he had an ambulance waiting in your driveway. I bet you he hired an ambulance.
Yeah. So was your husband pretty much on board? Like you guys were aligned on this?
Like, yeah. There was no question. Yeah. There was no question about it. It was always going to be a hospital birth, and I don't regret it. I have to say that to preface this, I had the whole experience, good and bad, in my hospital birth. And I have to say, I am very glad I did it in the hospital. And I can say I would never have to do it again because I didn't miss out on a single thing. And you guys will find out why. My story gets a little wild. So Tessie, when you do a home birth, is it just one section of the house that is reserved for you? Or are you just still all about the house and like walking around, kids everywhere and just waiting and you're in labor? How does it work for you and your midwife?
Well, for me, I get rid of my kids. I send them somewhere else.
Yeah.
It's so funny because we have the run of the house. We could do whatever we want. The midwife does not restrict us to anything. They work around us, which is really nice. So wherever I am the most comfortable, that's where she would just adapt. That's what they do. But it is interesting. I always would take myself into just one bedroom. It's not like I would walk around the entire house. I didn't do that. And oftentimes I would just like go off into a little corner, like on my rocking chair in my room, or stay on my bed or go in the shower. No, it's nice. You have a ton of freedom and they just kind of adapt to wherever you are. So it's nice.
That's really cool.
They don't like restrict you or say, as far as I remember, I wasn't told anything. Sometimes they'll guide you. Like my first one, they would guide me and be like, maybe you should try this position, or maybe you should try sitting here, or you know what I mean? But yeah, it's really nice.
For me, I had the whole room and it was a pretty spacious room. And I also had the whole hallway to walk up and down. And I had like the peanut ball. I had a whole bunch of stuff. I didn't have a tub. My facility didn't have a tub for water births, which was fine by me because I wasn't planning on doing that anyway. But yeah, they did make a lot of suggestions and they just kind of left, just said, hey, you do what you feel like. And that's it. Yeah, it was really great. They would come in periodically to check on me. Hey, you okay? Is the pain bad? And I tell them, I give them feedback, and then they would say, okay, do you want your meds? Do you want this? Do you want water? And I'm like, yes, water is good. Were you excited? So when you went into labor the first time, did your water break?
No, he was late. There was a water bubble under his head.
Mhm.
So my midwife actually had to break the water. And then because I had been in labor for like a day, like 24 hours at that point, probably. And maybe even longer. We were just like, okay, let's try to move this along. And it worked. So like once she did that, then like I started to progress because I hadn't been progressing. And it's so funny. Of course I was excited. I was like, yes, I didn't know what I was getting myself into pre and post. You know, I was like, I'm finally going to have my baby, and not knowing even a fraction of the extent of how hard that was going to be. And just the effort, you know, just the total lifestyle change. I was so excited, and I was just ready. I was ready for my baby to be born. And so, I mean, then it, like at that point, it was just a very gruesome, painful, grueling night of labor.
The first one you were in labor for 24 plus hours. So was it like 48 hours?
It was 38. Yeah. 38.
What about your second one?
And then my second one was dramatic. It was like 12, like dramatically less.
Wow.
But for my second one, I psychologically knew what the pain was going to be like. And I was not pushing him out. I do not want to do this. At some point, literally, my midwife was like, he is not coming out any other way. You have to push him out. And then I finally did. But I was just really avoiding it. But it makes me wonder if I would have just went along with it, if it would have went faster. I just didn't want to do it. At that, like the second one, I was definitely not exciitely. I knew what I was getting into.
Right. How about your third one?
Third one, I was more excited. Definitely not excited. I'm never excited to like go through the labor and delivery process. Like,
right.
Right now, I'm still like dreading it. But my third one was, I don't know how long that was. I want to say like 8 hours maybe, or 10.
So much shorter.
Much shorter. And then my last one was, I think, like 8 hours. So not like super short, because I've heard of like really short ones, like an hour or 4 hours or something. An interesting fact about my babies is my second baby and my third baby, they were both born in call, which is spelled Encaul, Encaul. So they were born in the sac, like vaginally born in the sac.
That's crazy. That's so rare.
It's super rare. It's like 1 in 80,000. Super
Both
rare.
of them.
Both of them. And my third one, I had a doula who was taking pictures, and we got a picture of him like completely coming out, completely encased in it.
That's crazy.
I know.
That's insane.
So for those two, my water never broke because they were still completely encased in it. So my water didn't break until they came out, and my midwife kind of like tore it open, and it kind of like burst open. And then with my last one, my water broke right before she shot out. Like,
she came out with a rush.
Yes, I like. And you know what's really interesting? She loves water. We were at the pool for like 4 hours. She stayed in the pool the entire time. Then we came home. She stayed in the bath for like an hour. She always wants to go in the shower and the bath. She just loves water. So I wonder if that's like related.
It's really interesting.
Oh.
Well, I'm hoping that for this one, you're in labor for like an hour, you sneeze, and baby comes out. That's what I'm hoping for you.
I know. Well, let's go at least 3 hours because my midwife is 2 hours away.
Okay. True. Very true. That's a good point. Okay, let's go 3 hours. Okay.
Yeah. So did you have any expectations, even though you were flexible with like your birth plan? What did you actually expect going into it? Did you even think about that, or were you just more whatever happens, happens?
So for me, because of my maternal age and the fact that my daughter's IVF, that makes me higher risk in both cases, I had to be induced. So rather than waiting for 40 weeks, they waited for 39 weeks. So I went a week earlier and I picked a day, and I thought, this is the day I want, because I want her to have a birthday with my mom. And I was so set on that. And it was like a Friday. And my husband's like, honey, they may not accommodate you. It's a holiday. It's going into a holiday weekend. They may not. I was like, but I really want it. And they did. They accommodated me. They said, yes, let's do it. And so I didn't really know what induction meant. I kind of got the gist of it. So for those of you who don't really know, induction is usually when you wait for a woman to go into labor. I went in and they start pumping me with drugs to get my contractions to start or to even accelerate. And they give me something called Pitocin. And it causes smooth muscle contractions. They also dilate my cervix with medicine and things like that. And hopefully with gravity, everything just comes out, right? I was also told that it was much more painful, which I believed because here I am, my pregnancy has been mostly with medicine. And I know that my symptoms of pregnancy were a little bit more exaggerated than I think maybe a regular pregnancy would be. So I was expecting to be in pain, but I had never done it before. So I said, well, it's going to hurt. Might as well. Let's just do it. So I kind of took the let's just see how it goes route. But the only thing I really wanted was for my daughter to share a birthday with my mom. And that did not happen. That was it. So I went in, it was the day before, and the OB office took care of everything for me. They made the appointment. They did everything for me. They were ready to have a bed for me at a certain time. I didn't have to do anything. They said at a certain time, past around 8:00, that the night before you want to give birth, we're going to call you to tell you to come in because we have an open bed. So come on in. So I waited and 8:00 came around and they never called. And then 8:30, the nurse called and said, hey, we don't have any open beds because they're all full. Do you want to wait? Do you want to be on standby, or do you just want us to call you tomorrow morning and see how it goes? I really wanted to give birth on that day. I said, well, put me on call and let's see what happens. So I didn't sleep that night. And at 11:00 at night, just as I dozed off, I got the call. They said, come on in. So in the middle of the night, my husband and I, we went in, and my mother-in-law and my father-in-law were here already because they were here to support us. And we left them at my house, and my husband and I went to the hospital in the middle of the night. They gave me a room. They were super sweet. They hooked me up to IVs and everything. And they took down my plan and all that stuff that we already talked about. And they checked me and they said, oh, you're already 3 centimeters dilated. I said, what? They're like, yeah, you didn't feel anything? I'm like, no, they're like, Braxton Hicks, any sort of early labor? I'm like, no. They're like, this should be really fast. You'll probably be able to give birth in the next, by tomorrow morning. We're expecting 4 or 5 in the morning, you may have your baby. I'm like, awesome. So I'm texting my family like, hey, I'm at the hospital and this is what's happening. And I should have the baby before the sun comes up. I was wrong. So wrong.
Really?
So wrong.
What happened?
So for me, they just hooked me up to my IVs, and they started the Pitocin, and they started the cervical ripening and all that. And I was progressing. Within an hour, or maybe it was 2 hours, I was another 2 centimeters. So they were like, hey, you're halfway there. Do you want your epidural? Now, I am one to say, give me the drugs, give me all the drugs, give me the drugs I'm not even supposed to have, because I don't want to feel a single thing, because I'm a big baby when it comes to pain. So my husband looked at me and he said, well, this is what happens in epidural. You have to stay really still. And I know you don't really stay still when you're in pain because they're right in your spine. So you have to stay really, really still. Let's just, maybe we should do it now. And while you can still control your movements. And I said, okay, all right, let's do it now. 5 centimeters. Let's just do it. And I'll progress and it'll be just fine. They did give me the caveat that you may not progress. And they said, that's really rare. I said, okay, well, let's just, I don't want to feel pain. Let's just do it. So I did. And then my labor kept on going, but I stopped dilating. That's where
because
it all
of the
stopped.
epidural?
Yep.
Oh.
Yep. And after that, I couldn't feel my legs, obviously, because from the waist down, everything is numb. Although it did really help with checking the cervix, seeing how far I was dilating, because that is a really uncomfortable exam. That is not fun.
Wow. I've never had that.
It hurts. So once I was numb, it wasn't so bad.
my
And
God.
they had to put a catheter in because I couldn't urinate. So I was bedbound the whole time for the rest of the time. That was it. They kept on turning up my Pitocin, and they were just watching. They're like, "Oh, that was a really big contraction. Did you feel that?" I'm like, "No." And it just reminded me of my mom, because my mom was the same way. They're like, "Oh," with me, they're like, "Oh, that was a really big contraction. Are you okay?" And my mom's like, "Oh, I thought it was just a hiccup." Apparently, I have a really high pain tolerance. I have a really high pain tolerance, just like my mom does. And apparently my sister does too. So thank you, Mom.
Wow.
So what happened was, as they kept on increasing my Pitocin more and more, they even came in and they burst the water. They burst my water for me. And
Mhm.
I didn't know what that would be like. They're like, "Okay, it's going to feel like you peed yourself." And honestly, the medicines for the epidural made me a little woozy. So I did a lot of sleeping through the whole thing. I don't remember a lot of it because I was asleep.
Wow, that
And
sounds
so
so
I didn't,
nice.
yeah,
That
that
sounds
was
so
nice.
nice.
And that's why my husband never pushed for an earlier C-section, because he saw that I wasn't in a lot of discomfort. So he
Mhm.
just was like, "Oh, let's just wait and see. Let's just wait and see."
Mhm.
And I don't remember much, though. He made most of the calls for me. Thank goodness he knows
Mhm.
what he's doing. And when they broke my water, I remember going, "Oh my gosh, I think I peed." And they're like, "No, that's just the water, sweetie. It's okay. We talked about that." And I was like, "I'm so sorry. I think I peed." And I was very addled. But the nurses were wonderful. The doctors were wonderful. I did not have any music playing thing. And that's another thing. I did not buy a separate robe for birth. I know a lot of places, I was reading a lot of blogs. They're like, "Oh, you should get a nice comfy dress to give birth." And I was like, "No, I don't want that back. I do not want that back. You keep that. I can burn it for all I care." So that was just the beginning of my labor. I ended up in labor for 26 hours, actually.
Wow. But you slept
Yeah,
most of it? That
I
sounds
did. I did.
glorious.
Yeah. Yeah. So it wasn't a terrible experience. I did
Yeah.
feel some pain, but it wasn't bad.
Yeah.
And it wasn't like, I wasn't like crying the whole time. I wasn't angry. I was just kind of going with it. So it really wasn't a terrible thing. And it wasn't until they saw that my daughter was in distress that they said, "Okay, it's time for a C-section."
Yeah, how did they recognize that?
So I have a fetal heart monitor to monitor the baby's heart rate. And Pitocin, what it can do is compromise the baby's heart rate, making it drop. So they're turning up the Pitocin, trying to get me to dilate more and go into bigger labor. And her heart rate started dropping. And I remember it was like 2 in the morning. And or maybe it was 3 in the morning. I don't remember. It was in the middle of the night. My husband had been sleeping in the chair next to me, and I wake up, I open my eyes. I don't have my contacts in. I don't have my glasses on. Everything's really blurry. And I see the whole unit in my room. And I'm thinking in my head, "Oh, that's not good." And they turned the fetal heart monitor away from me because they know
What?
we know how to read it. Yeah. And that's what they were staring at. And I remember thinking, "Oh, this can't be good." And then I had one OB on when I came onto the unit. Now I have a second surgeon because they just switched off. And the doctor said he was really nervous. He goes, "So, Diana, we really want to talk to you. I think we really need to do a C-section." And he looked at me. He didn't know me, so he was really nervous. And I looked at him dead in the eye. I said, "Do it. I'm so done. I'm done with
Mhm.
this." And he just like, the look on his face was, "Thank goodness."
She's not fighting me.
And he was like, "Well, do you want to know the reason?" I said, "Well, yeah, that's a good idea. That's a good idea. Why? Why do I need it?" He goes, "Well, it's not an emergency, but the baby's heart rate is dropping and we're okay right now, but I don't want to give you any more Pitocin because it's compromising the baby." I said, "That's good. When can we go?"
So she was at least in the right position, right? Like
Oh, yeah.
there wasn't a
She
problem
was
there.
no problem. She was in position for weeks. She was ready to go weeks ago. She's like, "Let me out of here." But
That's
mama just wouldn't
great.
let her go.
Yeah. Oh, that's wow. I didn't know that the epidural could do that.
Yeah. Yep. It does do that. It happens sometimes, not often, but it does. And it happened to me. Oh, and
Yeah.
another thing was that I was allowed to have visitors. I couldn't have a whole bunch of visitors, obviously, because it's a clinical setting and, I'm in labor. But they let my husband switch out with my mother and father-in-law, who, like I said, were in town and they wanted to come see me. So they came in and they saw me. And then they did the sweetest thing. They didn't go home. They sat in the waiting room the entire night into
Oh,
the next
wow.
day.
Oh,
Yep.
wow.
Yep. And so when we decided to do the C-section, my husband went outside to tell his parents and they came in to see me and to wish me luck and give me a kiss and let me head on out. So that was nice.
Aw, that's nice.
But at that time I was so over it. I was so done. And
Oh my
my
God.
favorite moment was, "Oh, don't you want to know why?" I'm like, "Because I'm done.
Yeah, I'm over this.
I'm so over this. I just want to be done now." So I have a question for you about home births. Heaven forbid there is an emergency. What are the protocols?
I mean, they will transfer you to the hospital if they need to. They will.
Uh-huh.
They'll call for an ambulance or say like, "Okay, well, you're not progressing." I don't know exactly, but they will transfer you. And they know when it's a good time to transfer to the hospital. So they will. Yeah, they will. And then as far as like if something happens with the baby, they're all like super trained on neonatal resuscitation and they're trained on all of these emergency things that they could intervention wise if they had to.
Uh-huh.
I don't know. I'm kind of like this kind of person that I don't think about it going bad. I just always am just, oh, it's going to be fine. It's going to be fine. Except for the only thing I think of that I am afraid of is that I'm going to die in childbirth. That's like one thing that my husband's like, don't think about that. It's not going to happen. So I'm like, what would all my babies do without me? Such a horrible thought.
But it's true. It's true. It's something that runs through your head, right?
Yeah. I don't know why. That's like this weird, when you're pregnant, you have like weird thoughts, and that's one of them.
Well, I mean, and so statistically, for a healthy woman, the most dangerous thing she will do in her life is give birth.
True.
So, and it wasn't until recent modern medicine that giving birth is kind of like a whatever thing. Thank goodness for modern medicine that it's kind of become a normal occasion for us. But normally it's a whole event and it can be very risky. Thank you, modern science.
Yeah, I know. So luckily I have a good track record. So
Knock on wood.
that helps. That kind of helps calm me down. But yeah, I don't know. I just go into some of these things sometimes. I just have a lot of faith, I guess. And I just like expect it to be, I just expect it's going to work out. You know what I mean? Like,
I love that.
I don't think it's going to be bad. Like my first one, I was like, piece of cake. Look, I watched it on YouTube. I could do that. But then, that any mom out there who's like given birth naturally, there is a point where you literally think you're going to die. And I think they call it the transition, but I'm not 100% sure on that. But it does come to a point where you're like, I am going to die. I cannot do this. This is way beyond what I am capable of. I'm going to die, basically. And then it's not long after that feeling and those thoughts in your head that the baby's actually born. So it gets to this massive like point where you're just, I can't do this anymore. And then you just finish it. Yeah.
You just do.
Yeah. And then that's why it's like, if I was in the hospital at that point, I probably would have asked for some sort of like medication or something that I really didn't want. But because I would have had the option, I don't know. I might have taken it, because it gets worse than I expected. Yeah, it's there. Yeah. And I'm like at this point where I'm like, oh, I'm going to die. I can't do this. This is too hard. Just all those thoughts.
That was another thing with my plan. It was drugs. Give me the drugs. Give me all the drugs. Even the drugs I can't have, give me all the drugs. I did not want to feel anything. And in a lot of ways, I didn't because, like I said, I slept through most of it.
Yeah.
It took about an hour to prepare me for surgery because they had another woman in the OR and that was an emergency. So mine at the time wasn't, thank goodness. And the nurses came in and they said, we're so sorry that you're still waiting, but we have an emergency. I said, no, you take care of her. I'm fine. Baby's fine. We're chilling. And when they did come to take me in, they increased my medicine to kind of numb me. And or they gave me something else. I don't remember, honestly, but I got so sick. I started vomiting all over the place. It was horrible. They wheeled me into the OR, and the anesthetic nurse, he was standing next to me, and he was the sweetest thing. He goes, so this is what's going to happen, and this is what you're going to feel. And I said, I'm so sorry. I'm going to throw up. And I threw up on him. He goes, okay, let me just grab a bowl. And I threw up on him. I felt so bad. I was so embarrassed. I was so sleepy. I was so nauseous, and I was so cold because in retrospect, I remember this. They stripped me naked.
What?
They stripped me naked. Yep. They stripped me naked. I was strapped down. My legs and my arms were strapped down because I was having not a seizure. I was having convulsions. My limbs were just moving on their own. I had like restless leg and rest because of the medicine. And I was shivering because I was so cold. And I remember my teeth chattering. And so I'm vomiting. I'm freezing. It was just not, it was horrible. It was awful. And I threw up on the guy, and he was the nicest guy in the world. And then they took my husband beforehand, and they had him change into scrubs, and he was at my head the whole time. And they put up a sheet between like right at my chest, so I couldn't see what was going on down there, because you don't want to see a C-section. Do not look up a C-section on YouTube, guys. Do not.
Okay. I won't. Now I will. No. Now I'm curious.
I'm glad I didn't, because I think I would have been horrified.
Don't tell me no. Don't tell me I can't do something.
You don't tell me, I tell you. Okay, Tessie, you go look up a C-section.
Yeah. You got to do reverse psychology on me.
Exactly.
Now. Like...
You and my daughter. And my husband, he's performed C-sections before. He said, honey, you're going to feel a pulling, but no pain. I said, okay. And I was so scared. I remember telling him to talk to me about anything. Where are we going to go on our next vacation? And
that's funny. You guys are planning a vacation.
Yep. Because I wanted something to look forward to.
Yeah.
And I remember when they went to make the incision, and you know when you get a cut on your finger or something like that, you feel that tug on the skin.
Mm-hmm.
I felt that tug, and I was just bracing for the pain, which never came, fortunately.
Wow.
Yeah. So it was a very weird feeling. And then they said, okay, a little bit of pressure. And my husband says, now when they're going to press down on your tummy, you're going to get nauseous. Sure enough, I threw up on the anesthetic nurse again.
Oh my gosh. I wonder if like getting nauseous and throwing up is like a common thing in C-section, or was this a rare thing?
I don't know. I know for me, I metabolize medicine slowly, so they have a very, very strong effect on me. So maybe it's that. I'm not really sure. I don't remember my mom telling me that ever happened to her. And like I said, she had C-sections.
Yeah.
But then once that pressure, and once I threw up on the nurse again, all of a sudden, the first things I hear were two things. Whoa, big baby, and whoa, lots of hair. And all of a sudden I hear this cry. And I was thinking, first thing I was thinking is, oh, thank goodness I'm not throwing up anymore.
Yeah.
And then my next thought was, is the baby okay? And so my husband looked over, and he's like, yep, she's fine. She's healthy. She's good. And she's screaming. And his voice is the first voice that she hears. And he says, it's okay, baby. You're safe. You're okay. And she just stopped. And I saw her look around. Like, I know that voice. So she didn't hear my voice first. She recognized him. Yeah.
Oh, that's so cool.
Yeah, it was very cool. And afterwards, my husband asked me, do you want me to stay with you? I said, no, you follow the baby. You can't do anything for me. I said, go hold the baby, give her skin to skin immediately. They got to stitch me up. So I was there for, I think, another half an hour while they stitched me up. And I didn't throw up anymore. I was very proud of myself.
That's great. Yeah. Wow. So then you didn't get to see your baby for half an hour?
Half an hour to 45 minutes. Yeah. My husband did. He was with her in the recovery room. And when they wheeled me in, he was holding her. Yeah. And it was the middle of the night. It was just me, my husband, the baby, and another nurse. And they immediately gave me the baby, and she latched on me. She found my breast. I didn't even bring her up to my breast, but she just latched on like an alpha predator.
Wow.
Yeah, it was, and I thought, whoa, what's going on here? Because I'm still confused. I'm still not me yet. I'm thinking, whoa, what's going on?
I
And
think
we
I've
stayed
seen
in,
YouTubes of that where the baby's like, what do they call that?
I forget what
And it's
they,
like
but
crawls up to it and just
yeah,
like grabs
I for,
on.
basically
Yeah.
that's what they did. They rested her on my belly and she took off and found my, and opened her mouth and that was it.
That's incredible. That is
It
awesome.
was. It was. What were the first moments with your baby like?
Well, with my first one, I lost so much blood that I couldn't even sit up in the bed without passing out. So I had to lay in bed for 24 hours and like had to learn how to nurse at the same time while laying down, which is impossible,
Yeah.
and couldn't stand up. Like it was just horrible. And I'm a very active person. I can't just be laying in bed for it was very hard. But I held him. But with my first one, like I said, we told everybody right away and they showed up right away. So I didn't even really get to hold him very long. And everybody else was holding him. And then with my second one, we kind of told them, I think it was right away, but they didn't come like right away, but they came pretty quickly. And then after that, I was like, okay, no, like we're not telling anybody until I'm at least showered and dressed and I'm laying with my own baby for 2 to 3 hours, like not moving, having it on my chest and all this. I guess I got a little miser each time on I'm going to spend some time with my baby.
Yeah.
Yeah. So
No, I love that. Did your babies latch immediately?
yeah, but the first one I didn't know what I was doing, and it's definitely skill that it's not. I mean, these experienced mothers make it look easy, but it's definitely not. You have to learn how to do it. So that one was harder. But yeah, for the most part, they all did. And my whole thing directly after the baby comes out, it's just such like a relief. You're just like, oh my God, it's over. You just like lay back and you just like, don't move. You're just, I'm not, no.
You're
And then my
exhausted.
midwife wants to get the placenta out. And I'm like, I don't care.
Leave me
Pull it
alone.
out. I'm not pushing out, but I have to.
Yep. Yeah.
So it's just like this immediate, like just relief. You just can't even describe it.
At least your first thought wasn't, hey, I'm not throwing up. Yay.
Yeah, no, I'm trying to think what my first thought. I guess my first thought was just like, oh, thank God that's over. Each time.
I did think that.
Yes.
I did think that too.
I'm never doing that again. That's what I think too. My first thought each time. Here I am, number 5.
Obviously, your husband did not listen to you when you're yelling out the door, get a vasectomy.
Seriously, with my last one, I was in labor. I'm like, you are getting a vasectomy tomorrow. You are setting it up. All this. And I don't know. He's like, okay, let me just pat your back. But he would always fall asleep. He would be laying next to me and falling asleep. And I would get angry at him for that. Like, why are you sleeping? Wake up. But it's the middle of the night. I've always labored from like the late afternoon, early evening, all night. That's been my thing. I'm probably going to go have the same thing happen this time. I don't do it really during the day. Like I always start like in the evenings, and then it ramps up.
I was always afraid being in labor and the pain that I would say mean and horrible things. To my husband was one thing. He knows me. He'll just brush it off and say whatever. I was afraid that I would be mean to the nursing staff. So when I first checked in, I prefaced with, if I say anything, please excuse me. I don't mean it. And we did. I remember now, we did buy pizza for the staff that night and bagels for the staff that morning. I had my in-laws bring them over. So we fed the staff.
Awesome. That's awesome. I bet they loved that.
Yes. And they took excellent care of me. I do have to say that. So how did your recovery look after giving birth? Were you moving around quickly soon after, since you had a vaginal all natural birth? What was it like?
Yeah, I would say as soon as I could stand up with each of them, as soon as I was done like holding the baby and ready to go, I showered right away, got dressed. I could walk around the house. They kind of forced me to eat. I never have an appetite after that, but then they're like, you have to eat. And so they're like shoving food down my throat and drinks and stuff. And yeah, like as soon as I could, but I stayed in bed. I mean, I stayed in bed as much as I possibly could. You know what I mean? But like I could get up and I would walk around the house within a day, within
That's
a few
good.
hours, depending on the baby.
Right?
I stay in bed though because I can.
Yeah.
Might as well take advantage of that.
And
Resting.
do you find it easier with each baby that you're like, I'm just staying in bed, forget this. I'm not missing out on anything. I'm just going to do me.
Yeah, I think so. Hiding out in the bedroom.
Yeah, right?
No, but also at the same, I don't want to be walking around. I'm resting. And my midwife, she doesn't think that I should even be getting out of bed for 30 days. And there are some cultures that do
Yeah.
that even longer.
Chinese culture is very
Yeah.
much like that. Your first month, you do nothing.
Mm-hmm.
It's called the sitting month. Ideally, you have everyone else around you doing everything for you. It's just you and the baby. And there are other different cultural things that go with it, like so you don't bathe for a month, all that other stuff. But
I
I
would
did not
not be
adhere
able
to
to
that.
do that.
No, I didn't do that. But in Chinese culture, in China now, for really wealthy women, they do that. Not that they don't bathe, but after they give birth, they go directly into like this sanctuary where it's just them and the baby, and they are waited on hand and foot. Husbands are nowhere near. They're allowed to come visit, but they go home. Family can come visit, but they have to go at a certain time. And the women are waited on hand and foot. All they have to do is nurse the baby if they choose. If not, you can come see the baby whenever you want. And your job is to just rest and eat and sleep. That's it.
Yeah.
I was like, wow, they took it seriously. But
I think if it was up to my midwife, that's what I would probably be doing for 30 days. But I do like each baby, I do take it a little more seriously that I do need to rest. And I also am older and my body doesn't recover and bounce back the same. And there's probably something to that. I could see there being something to pelvic floor healing and stuff when you're not walking around and doing all of this stuff. And maybe that's why, like here in America, we have all of these issues that require surgery way down the road because we can't like keep in our pee anymore or whatever. I don't know. I'm just like hypothesizing in my head.
yeah.
But maybe there's something to that. There's got to be a reason that they do it that way.
Well, I mean, our American culture doesn't really allow us to sit still much. Even for me, I was numb from the waist down, and my recovery, after they took out the afterbirth and they stitched me up, they sent me into recovery to see my baby. An hour in recovery, I went to my room, and that's when they started coming in. Everyone started coming in, the nurses to check on the baby, and they would take the baby and clean her and do tests on her, check on me. So it was this never ending litany of people coming in, and you just never get to rest. You never get to rest because as soon as you doze off, someone else comes in because it's their job. They have to keep an eye on you.
Yeah.
And so it was not peaceful. And I remember thinking to myself, I'm getting out of here as soon as I can because I can't. This is every single time they came in here, they made my baby cry. She was not a crier. She was a very calm baby at birth. And they came in, they would take her blood and do all these things to take her to the Billy light and all that. And I was just, as soon as I could, I'm out of here with her. So they told me, we're going to see if you can walk. You probably can't walk yet. It's been less than 24 hours since you gave birth. It's been like 5 hours.
Sleep.
Nope. No sleeping. No sleeping because they're poking me and giving me drugs and telling me to rest. And and then lactation would come in. And that was another thing. Lactation made me so nervous because, like you said, nursing is a skill. And even though she latched like an alpha predator, I didn't know what I was doing. I didn't know if I was producing milk. I didn't know anything. And so lactation came in and said, oh, you need to hold her like this and you need to do that. And you need to put her on this side for this long and this side for that long. And you need to record all this. Oh, that's another thing. Afterwards, you're recording every single time the baby takes a bottle, when they get changed, whether it was a wet diaper or a dry diaper or a soiled diaper, how much they're taking in as food and all that stuff. So you're constantly writing and taking notes and just measuring everything. So it's not calm.
Oh my gosh.
And that's when I said, I'm out of here as soon as I could. I think 5 hours after I gave birth, they're like, oh, we're going to see if you can walk. And I said, I can walk. They're like, I don't think you can. I'm like, no, I can walk. And my husband's looking at me. My husband's like, honey, I don't think that's a good idea. You know, you and meds, they last a really long time. I'm like, I'm going to walk. So they got me ready. And I don't know how in the world, how in heaven's name I walked because I could not feel a single thing in my legs, but I walked. I walked from my bed to the door and back, and I did it without stumbling. And I'm a clumsy person, so I stumble even now, but I did it. I don't know how, but I made myself walk. And they said, whoa, you can walk. I said, yeah. Can I go home now? They said, yeah, you can go home if you can pee.
Oh, gosh.
I said, okay, no problem. I can pee. I did not pee. I could not pee because the medicine would not let me pee. So I had urinary retention, and they came in like every hour to ask, did you go to the bathroom? I said, nope, but it's coming. Oh, I don't feel anything. I'm not uncomfortable. And they're like, okay, if you say so. And my husband's looking at me like, you sure you don't feel anything? I'm like, no, I feel fine. And then they came in and they said, okay, really, we're concerned now. You haven't voided yet. We're going to take an ultrasound of your bladder to see if it's how full it is, because you need to go to the bathroom. And I said, I don't think I have to go. I'm pretty sure my bladder's empty. And they ultrasound it and they said, nope, you have a very full bladder. And while they were ultrasounding it, oh my goodness, the pain hit. My bladder was so distended that it was putting pressure on the sutures they had just put into me.
Oh my gosh.
And was stretching it. It was just, tears were just running down my face. And they said, okay, we're going to straight cath you. And for those of you who don't know what straight cath is, it's literally a catheter that they thread up into your urethra. And then they basically, it's a straw for you to pee through, basically into a basin, basically. So again, they reclined me, basically stripped me naked again.
My God.
And yeah, there's no modesty. And so my father-in-law left. My husband was at home sleeping. The baby was in her crib in my room, and my mother-in-law was there. And so my mother-in-law has seen everything at this point because I have been stripped naked multiple times. She and I are close, but we are super close now.
Yeah, it definitely sounds like there's a lot of like violations, I guess you could say, in a hospital.
There is no modesty left. I now understand when women say, oh, I have no modesty left. I gave birth. Now I get it. Now I'm like, whatever. I gave birth. Who cares?
Yeah, it's true. It's true.
And they straight cath me. Unfortunately, get this, they put it in the wrong hole.
What? Mm-hmm. Where did these people get their license?
So she was a new nurse. She's new. And she put it in my vagina rather than my urethra. And the supervising nurse was like, that's the wrong one. And the girl who did it she was horrified. And at this point, I'm in a lot of pain. And I was like, I understand that mistakes happen. And I know you're learning, but can I please ask the other nurse next to you to put the next one in? Because I am in a lot of pain. And she goes, yes, of course. So they ran out, got another sterile one. And at this, I said to them, I don't care if it's sterile, just do it. And they're like, no, we can't not put a sterile catheter in.
Oh my goodness. Yeah. I remember that being like one of the first things they make me do is walk to the bathroom and urinate. And I just recently heard that it's because it helps with contractions, like contracting the uterus. If you don't pee, like that could be a problem there with like bleeding and all kinds of stuff, right?
Yep, because the distended bladder gets in the way of the uterus trying to get back into a smaller shape. And at that point, the blood vessels are still dilated rather than closing up. So yeah, that's important.
Yeah, that's like very typically important. When I'm like ready to pass out is when I'm walking to the, oh my gosh, this just made me think of this. After my third baby, somehow like a ton of blood got all over the carpet. It looked like a murder scene. But normally that doesn't happen. That's not a normal thing that happens because I've had 4 and it only happened once. But it did, like a bunch came out as I was walking to the bathroom, and it was right on the carpet, of course, right before the tile. It was all over, right? And they made it disappear. They cleaned it up with peroxide.
Yeah.
It makes blood disappear.
Yep, it does.
And you couldn't even tell. It was like really fascinating.
Yep. the oxidation properties of hydrogen peroxide actually helps to break down blood. If you cut yourself and you get it on a shirt and it's stained, soak it in peroxide and then put it in the laundry.
Yeah, we do that now every time, like when we get it, when my kids have it on their clothes or their pillowcase or something. It's really fascinating.
Yeah. I think it's the idea of where OxyClean comes from,
Huh.
the oxidation process. So yeah, I
Interesting.
learned that in surgery. Because
That's
having to
interesting.
clean all the towels and everything, you see that, oh, they use peroxide. Okay, cool.
I
That's
know.
an easy
You
fix.
watch all these CSIs and whatnot, and they always talk about bleach. And here it's like
You're like,
these dumb criminals should be using peroxide. That's why they're criminals. They're stupid.
or they're taking cues from Hollywood and they're telling Hollywood, don't tell them to
Misinformed.
actually how to get away with murder. Oh,
Well, now we know. Our
now
husbands
we
better
know.
watch out.
My husband knows that trick too. So does yours. They're medically
I
trained
know.
too.
I know. This is why we don't have life insurance.
Something you and I have to talk about later on.
That's funny. Yeah, no. Who wants life insurance on? It's funny though, because my husband handles like all of the finances, paperwork, taxes, like you name it. I do not do adulting. Okay. I hang out with little babies and kids all day. That's all I do. And that's like the capacity of my brain. So he's like always bringing me papers to sign, like random like tax forms or bank forms or whatever. And I'm always joking with him, oh, you're getting another life insurance policy on me. Like, okay, let me just sign it.
So in my family, it's the opposite. I do all of the adulting and the child rearing. My husband goes to work basically and he comes home. And if I want his input, he's more than happy to, but he knows that I'm a control freak. So I need to do these things for my mental health.
Yeah.
So I'm always asking him, I'm like, oh, here's another life insurance policy I need you to sign your life away on. And he's like, okay, honey, whatever you want.
So funny. How much do you trust me?
Implicitly.
I'm making you more dead than alive. Do you still trust me? That's like definitely like a sign of a good marriage.
We digress. So going back to my straight cap. So they ran out. So after putting it in the wrong hole, they ran out, got another one, straight capped me. And guess how much fluid they got out of me?
I'm really bad at math and this kind of stuff. 2 liters. I don't know.
Close. An entire liter.
1 liter.
Entire
okay,
liter. An entire bag of IV, basically.
Jeez.
Yep. Was crazy. In my bladder. I'm like, no wonder I was in pain. And then after that, I was able to void on my own. So then they were like, okay, now you can go home because the baby was totally fine. Yep. Now you can go home.
You
the baby
didn't have
was
to
totally
stay
fine.
for like multiple days. They didn't require that.
I did not want to. They tried to get me to stay, but I told them, I said, look, I have a grandma, a grandpa, 2 doctors, and a teacher waiting for me at home because my sister and my brother-in-law were also at my house waiting for me. I said, I am well taken care of. And they said, yeah, we can't provide you that kind of care here. Yep, you can go home. And so less than 24 hours after I had my C-section, I was home.
That's great.
Yeah, it was. But oh my gosh, I remember the ride home was horrible.
Was it painful, like bumpy and stuff?
So painful. So FYI, the roads in Northeast PA are very broken down because we have so much salt. We have so much snow here that they put down so much salt to melt the ice during the winter that the roads just get corroded. So there's lots of potholes. And we were driving home and every little bump I felt, because not only did my organs move during pregnancy to make room for my baby, but now I have all this pressure in my new sutures that were brand new and it just hurt. It was a 10-minute drive home. I cried the entire time.
Oh my gosh, I can't even imagine. See, that's what I love about home birth. I'm at home. I'm in my own bed. I don't have anywhere to go. I just like roll over and go to sleep, go to my own shower, do whatever I want, go out to the living room. It's so nice.
Oh, can I backtrack for a second and tell you about my checkout process?
Yeah.
This is just to complete the whole experience. And mind you, it's like I said, I had the whole experience. I don't need to ever do it again. But if I were to do it again, I would still choose a hospital birth, to tell you the truth, because it makes me feel like I have better control of if something happens, I know that my baby and myself are safe. So that being said, I signed all my papers to be discharged, and my husband was with me and my sister was with me. So they took all my stuff, all my clothes and everything, and they took it down to the car. And I was in the wheelchair getting ready to go home, and I had the baby in my arms. And like I said, they went downstairs and they took my stuff down. They said, we'll be back in 5 minutes. All of a sudden, it's like 20 minutes. I'm like, where are they? The car is not far. It's just in the parking lot. And then I hear that there was a code being called on my floor, and they had to lock my floor. They had to lock the maternity ward because a woman was trying to abscond with a baby. And all of a sudden, I hear this screaming out right outside my door. She's saying that she has a gun, that she now, I don't know. I think she was lying because there's security when you come in. There's a metal detector and everything. I'm pretty sure she was lying, but she was yelling at security and the nurses that she has a gun and that she's here to take her baby and that they're not letting her. And she sounds completely out of her mind, like she was on drugs or something like that. Now, is it really her baby or someone else's? I don't know. But all I can think is, I hear this outside my door. She is right there. I'm here with my baby. No protection. The door doesn't even lock because it's a hospital room door. What am I going to protect myself and my baby with? I can't feel my legs.
Oh my God.
I was terrified. What if she tried to take my baby? So I decided, I wheeled myself back to the bed where I would put the baby. I decided if she comes into this room, I'm going to put the baby down and literally with everything I have launch myself at this woman to protect my baby and then rely on security outside to take the rest of it.
Yeah.
And because I had, what am I going to do? Everything is bolted down. I couldn't even swing anything. I didn't even have the ab strength to swing anything, even if I wanted to.
Terrifying. Yeah, that's terrifying.
It was horrifying. And my husband called and goes, "Hey, what's going on up there?" I'm like, "Hey, so this is going on." And he goes, "That's great. That's awesome. Okay. Well, are you safe?" I'm like, "At the moment, yes, but I don't really know because they're right outside my door." And he said, "Honey," he's like, "The nurses are there. Security is there. They are trained. You know how they're trained." And they were superb. They knocked her off the ledge. They calmed her down. And like 15 minutes later, everything was fine. They reopened the unit again and we were totally fine. But I remember thinking, oh my gosh, I had the whole experience. I don't ever have to do this again. And that being said, if I were to give birth again, I would still go back to the same hospital because even though all that happened and it was out of my control, the staff was in control at all times.
Yeah.
And they were well trained and I have confidence in them. So it's for me, I think it will always be a hospital birth, honestly.
Yeah. Oh yeah. For me, hands down, home birth.
Yeah. Because it works for you. It makes you feel in control because we are control freaks. And I think that's the hardest part with birth is that you feel out of control and that's a scary part, right?
Yeah. Yeah. And I just love the whole entire experience and don't get me wrong, actually, I have heard some horror stories with midwives. Like I have friends who have had like not horror stories, but like not as good of an experience. I actually happened to luck out like crazy finding my midwife. She was amazing, you know? And so like obviously it's like anything in life. There's really, really good ones and then there's ones that are like mediocre or bad even.
Yeah, right.
But as far as like the experience of the whole thing, like start to finish, so amazing. I just love it.
So did your experience with birth change the way you view yourself as a mother or how you view your own body?
I mean, I definitely just feel like, you know, after you do something that is that hard that you don't even in the moment, like you don't think you can even complete doing it. And then you do, you really do. You feel like a tiger or like a warrior or something. Mm-hmm. Like it really does make you feel like that's like an incredible thing that you've done. You know what I mean? And you do have that feeling, I think.
You feel like you're a goddess. You're invincible. You can do because you literally did the impossible, right?
Yeah, like take something that you've done that's hard in your life that you didn't think that you could do that was extremely hard and like multiply it by 1 billion. And like, how did you feel? How did you feel after that experience? Multiply it by 1 billion.
Yeah, true. You know?
True. Pretty incredible.
I know for me, I look at my body completely differently. It took me a long time to get to this point because, you know, it takes a while to kind of digest the whole birth experience. But for me, IVF and then pregnancy and now birth, it took a long time. But I realized my body's amazing.
Yeah.
It really is, because I realized that I set my mind to something. I said, I'm going to have a baby. So I defied my own biology and said, no, my body is going to carry a baby to term and give birth to a healthy baby. And my body said, okay, let's go. What do I have to do? And it did it.
Yeah. Yeah.
It did it. And here she is, this amazing little miracle. So my body is pretty amazing. And it took me nearly 40 some odd years to get there, but I eventually got there.
It is amazing what our bodies can do. Like,
It really is.
they are little miracles. I mean, it's just incredible. I would love to be on the other side of it one day, you know, like knowing exactly what's going on the outside of my head, and seeing it, you know, like if you see that over and over and over again, like that's just what an awesome job. I feel like you get to see babies being born. How cool is
I
that?
think that if you're in the OB field, I think there's a part of you that really has to love it, because it can be so stressful, right? It's anything can
Yeah.
happen. But if you love what you do, you know, your patients feel it. They feel safe. They feel taken care of. And that's so important.
Yeah, exactly.
So what would you say to someone considering a birth option different from your own?
I'd say you do you, whatever you're comfortable with. You know, we all just go with your gut, whatever you think. You know what I mean? Like if you're more comfortable going to a hospital, I get that. I have lots of friends who've done that. I totally get it. Yeah, just do you. Don't let anybody else talk you out of whatever you know what I mean? Like I'm a very strong-willed person though. I feel like my husband knows that, which is why he like didn't say anything. But like no one's going to change my mind. But if you really feel strongly about it one way or the other, you should do what you're comfortable with. At the end of the day, you're the one giving birth. Like I don't think it's anybody else's decision except for yours, period. Anyways.
I have to agree with you with that. I think do your research, really think about it, and do what makes you feel most secure and most in control.
Mm-hmm.
I mean, obviously, you and I, we have very different stories. We have very different choices. But what I love is that we both felt empowered with what we did, and we would always do it again. No matter what, we would go back to make those same choices. And I think that's really important and really powerful. So I think, yeah, you're right. You do you, and do what makes you feel the most in control.
Yeah.
I love that. Wow, we have really different stories.
I know. I've heard so many different stories of like hospital births, you know. I feel like the home birth stories are pretty similar that I've heard, you know, but hospital births, they can go like so many different ways. Like I've heard, I have one friend who told me that her epidural went up instead of down and she was like having seizures and stuff.
Oh my gosh.
So yes, like I feel like there's the gamut. I've heard the gamut stories, even home birth stories of like different. I've had friends who've transferred, you know, and things that didn't work out. It didn't work out the way they planned, but it's okay. They have a healthy baby. You know what I mean?
Yeah.
At the end of the day, they're all professionals that we're working with, both sides.
Mm-hmm. And I'm pretty sure that they all love what they do. And that's so important, because what they do is not easy.
Yeah.
Gosh, like I mean, I can't imagine like if I went through actual painful labor, how wicked and terrible I would be.
Yeah, you would definitely be like, well, this is so funny. Okay. My poor husband. I have such a mouth. Okay. I have such a sassy mouth. Luckily, he's a very patient man and he also loves me. So he puts up with it. Literally, like, he's like, and my finger hurts, or I like broke my leg or whatever. And I'm just like, childbirth. I don't want to hear you crying. I don't want to hear how painful your broken leg is. Do not come to me. I have zero sympathy. I say that all the time. He's like, I stubbed my toe. It hurts. And I'm like, get over it. Like, try childbirth. Don't even come to me with that nonsense. And then I'm like, oh, let me hug you. Okay. It's so painful for you.
I think that's the ultimate, like, to close off a conversation. You win. Try childbirth. They can't. You never will.
I know. And like, you know, honestly, what other pain? I've heard like kidney stones maybe are like up there, relate. But like, honestly, unless you're getting your legs sawed off with no anesthesia or something, like what relates to childbirth, you know, that anybody can go through. So and you do have like the ultimate like one up.
Yeah,
childbirth.
absolutely.
Don't cry to me.
And you did it without any meds. So
Yeah.
you definitely have the card, the ace.
I do.
Well, this was fun.
Yeah, I hope like you guys got a little glimpse of what it's like if you haven't done one or the other of what it's like, because I definitely did. I learned things. I know we've talked about this before, but I still learned things about your journey that I didn't know. And yeah.
I've always been interested in home births because I never considered it for myself, but I'm always fascinated because I want to learn more about it. And I mean, that's what our community is about, right? We are here to represent as many sides as possible, and we all have a voice and we all have our own stories. And that's what Pearls of Motherhood is all about. You come here, you share your stories with your views and your experiences, good and bad. Whether the catheter went in the right place or not, it's still part of your story. And now I can look back and laugh, even though I cried at the time.
Yeah. And I think it'd be fun. Like, chime into our Instagram and tell us, like, what did you guys do? Did you do home birth? Did you do hospital birth? I think home birth kind of has like taken off a lot more since COVID. So I don't know. I'm just curious, like, what are people doing out there? What are you guys
and
choosing?
why?
Yeah.
And why?
For sure.
We'd love to know why.
Yeah. Yeah, for sure.
So yeah. Thank you so much for listening to us at Pearls of Motherhood. Please feel free to contact us at pearlsofmotherhood.com and email us at ideas@pearlsofmotherhood.com. We're also on Instagram at Pomcast. That's POMCASTS. We'd love to hear your thoughts on this episode or any future ideas for other episodes. After all, we are a podcast for all moms and would love to know what you'd like to explore. New episodes drop once a week on Friday, so stay tuned for more fun and more pearls. Have a great day. Talk to you soon.
Bye.
Bye.